Hi, this is Dr. Rajesh Vunnamatla, Senior Consultant, Advanced Laproscopic, Gastro, Bariatric and HPV Surgeon, KIMS Hospital, Gachibowli. Obesity is basically the increase in weight more than what a patient has to be based on his weight and his height. We'll call it as an BMI. Once the BMI crosses beyond 25, we'll call it as an overweight, and once it costs more than 30, we'll call it as an obesity. There are some classes of obesity where this BMI is more than 30 to 35, we'll call it as class 1. 35 to 40 it is called class 2, and more than 40 it is called class 3 obesity, and later on more than 45 or more than 50 morbid, super morbid obesities. Most of the people, and nowadays there is a increase in the fat content of diet, so there is a weight gain in the young age itself and development of multiple comorbidities related to the obesity. Other causes like thyroid problems, some of the genetic diseases has the obesity, and nowadays the work which is related to constant sitting, there is no proper movement while doing work. All these are the multiple factors involved in the obesity. What are the complications of obesity? The people who are obese, they develop certain comorbid conditions which are very dangerous to health, like diabetes, hypertension, increase in cholesterol, knee joint problems, obstructive sleep apnea, we'll call it as an OSA. Some people develop gout. Overall, all these problems together, we'll call it as a metabolic syndrome, and which is has a more very high morbidity and mortality in life. So people ask like whether we need to go for a treat the obesity or not. I regularly tell that obesity itself is a disease. You need a certain treatment at every class of obesity. All obese people don't need surgery in the upfront. There are certain medications are there. There are the obesity stage where we can control it with a diet and an exercise. So once a people are obese more than his BMI is more than 30, we can control this with diet and exercise. But there is a certain stage or a level where the patient cross that level. These people needs a surgical intervention. For suppose if a patient had an obesity where it is related to a particular part of your body like hips, arms, thighs, and it is not a generalized obesity where all parts of body will have fat, then you can opt for a non-bariatric liposuction treatments which the plastic surgeons will offer, and you will have a weight reduction of approximately 8 kilo, 9 kilo or 10 kilo based on the fat you removed on that particular day. But coming to the bariatric surgery, it is a wonder surgery which changed lives of many people, saved many lives, because the complications of obesity are very highly morbid and mortality related. People will have sudden cardiac arrest and death, particularly in the night time. The category of people who has a BMI of more than 35 along with some comorbid conditions like diabetes, hypertension, these people need surgery, or else a patient who have a BMI more than 40, even if they don't have any of the comorbid conditions, these people also falls in the bariatric surgical candidates. Coming to the surgical aspect, it is done in a laparoscopic surgery. We use advanced staplers, so the post-operative pain and all these things are very less. We keep the patient in the hospital only for one day, that is overnight. Next day morning we will discharge. Coming to the costs of the bariatric surgery, all the instruments what we use were imported, or else Indian made, whatever it is, we all use completely staplers. So the cost will be a little bit high, and nowadays some of the insurances are covering the obesity surgery as well. There is a huge difference between the benefits that patients will come with the bariatric surgery compared to the surgical pain, or else the cost. All these things are very less. Weight loss surgery and the bariatric surgery is the future surgery which many people needs in the future, because of the percentage of obese people in the society is increasing day by day. In fact, the metabolic syndrome is increasing in the society day by day. Thank you.